Anterior aspect, posterior aspect. Okay, so when we're looking at on those, that's kind of how I've kind of labeled them on there. Okay, so depending on their injury, obviously is going to tell me where I'm working. Okay, but just for argument's sake, I'm going to be just going medial side, lateral side, then I'll go anterior and posterior. Okay, with bony landmarks, what we want to do is when we orient ourselves is we want to make sure that our thumbs get in this joint line right here. Okay, and so the best way I can tell you is that if you were to poke on the knee above and below the joint line, there isn't much give, okay? The joint line is going to be real soft, and you should be able to just kind of push in all the way around it, okay? And so that's kind of how we know we're in that joint line right there, but both thumbs kind of need to be in the right position, okay? So that's kind of the best location I can give you is kind of right either side of that tibial, or either side of the patella tendon, okay? You're going to find a nice little soft spot that you can push on, okay, on both sides of it, okay? That's kind of a good spot to just orient yourself. I like to keep my hands kind of in back when I'm doing this just because I can kind of control and manipulate the joint itself, and I can kind of swing it, open up that joint, I can turn it and twist it a little bit. If you have smaller hands, that's going to be a little bit more difficult for you to do, but that's why being an athletic trainer, big hands is a plus, so just a trait. So if you got big hands, you got a future in athletic training. That's what I'll just say there. if you choose to do that. All right. So first thing we're going to do is we're going to go medial plateau, which is directly inferior of our joint line. So if my thumb is on the medial joint line, I just come right down, and now I'm on that medial plateau. Okay. So that's the tibia right there, and I'm just kind of palpating right along that medial plateau, right there. Okay. So that's it. It's just the big bony structure that we're talking about. Okay. We're also going to palpate the tibial tubercle. Okay, so I like to just say if you look and you locate the patella tendon, it's going to come down and it's going to pop right onto that tibial tubercle. There's a big just bump that sits right here. Everybody's got one. Okay, some are a little bit easier to find than others depending on the size of the knee that you're at. But it is the bony. It's basically the bony protuberance that comes out from that tibia. It should be. It kind of starts just the shaft of that tibia all the way down. So you're kind of looking right there on that one. All right. So that's that tibial tuberosity right there. Okay. So that's where we're at. Okay. So we got tibial plateau, tibial tubercle, and what's the other one? The adductor tubercle. Okay. Now let me make sure I write this down. Okay. So I did. Okay. All right. Before we do that, the adductor tubercle. Excuse me. Go back up into your joint line. Okay. All right, and we want to palpate the femoral condyle, medial femoral condyle. Okay, so I want to come above the joint line, and now I'm on the medial femoral condyle. Okay, so right above it. Okay, if you think about the condyle, femur comes down, and it kind of makes a U on both sides. Okay, so it's kind of a little circle right there on the patella. All right, so the femoral condyle is just going to be right above the joint line, right on this side. So that bone that you're going to feel right there. Okay, if you're up here in the quad, you're too high. Okay, it's going to be right here along this line. So again, if we orient our joint line, we can kind of palpate all the way around the femoral condyle and back up into it that way. So it's just going to be right there. That's what we're looking at. Okay. Now your adductor tubercle. Okay, if I'm on the medial side right here of the femoral condyle and I come kind of towards the back, all right, there is a slight depression back here. Okay, you kind of see where my finger goes in. Okay, all right, the adductor tubercle is right below that. Okay, so if I'm in that depression, right, and I just drop my hand down, I'll feel this little bump right in here, and that's my adductor tubercle right there. Okay, I think that's it. Is that it? Yeah. Oh, patella. You don't get patella right, you fail. I'll just stop the test right there. You fail right there. Okay, sorry. That's it right there. That's the fail point right there. So just remember that one. Okay. Okay. So adductor tubercle. Look, we're looking at soft spot back here. Drop right down below. You're going to be on that adductor tubercle. Okay. And again, it's kind of nondescript, so that's why I hesitated putting it there, but the reason I put it there is because when we do the soft tissue, okay, we got muscles in here and they kind of come down below that adductor, so it's kind of a good identification point for those muscles. So that's kind of why I did it. I didn't want to because it doesn't pop out at you, but it is a good spot for that. So that's kind of why we do that. All right. So again, medial tibial plateau, okay, medial femoral condyle, tibial tuberosity, okay, patella, and adductor tubercle. Okay, that's on the medial side. All right, we're going to go to the lateral side. So I'm going to come over here. Your turn. Slide down. Since easier for me to do that than it is for you to swing around. Okay, we'll do the lateral side now, which is going to be on this outside part of it. Okay, get a little closer. Okay, so back in the joint line, like I said I was. Okay, and we're going to come to the lateral side of it. Okay, and just like the medial side, the first thing we're going to palpate is our lateral tibial plateau, which is right down here. Okay, and it goes all the way to the back right here. Okay, so that's our lateral tibial plateau right there. I think it's the first one. Okay, yeah. All right, lateral femoral condyle. So again, we're going to come back to our joint line. Okay, make sure I get in there. Okay, joint line. Okay, lateral femoral condyle is right up here. Okay, we're just going to palpate around that lateral femoral condyle. Okay, so that's it. Again, we don't want to get too high up into the quad, all right, because that's not going to help us any. So we want to be right down in this area right here. So this is our lateral femoral condyle right here. Okay. Next one, the epicondyle. Okay, now joint line. Make sure I'm back in that joint line again. Okay, joint line. Okay, the epicondyle is a bump that sits right here. There's a little ridge you'll feel again. Okay, so I just take my finger and I can kind of roll over top of that epicondyle right there. So it's kind of femoral condyle, and then there's a little ridge, and then again drops off into another depression back here. So we got that lateral epicondyle sitting right there. Okay, and that one. Fibular head, my favorite one. This is the best one to find. Okay, so I'm in my joint line. Okay, and I come to the side. All right, and I drop down. There's a bone right here. Okay, this is my fibular head where my fingers point. Okay, the best way to get the fibular head to kind of show that you're there is if you take their foot and kind of rotate it, invert it, and outward it. This will roll with it. So if you just kind of move it back and forth like this, take that calcaneus, kind of turn it lateral and medial, just like that. Okay. And it will roll with you if you're on it right there. So that's going to be your fibular head. So that's a really good spot. A lot of people like to test on right there because people forget that it's right there. Okay, they think it's up higher. They're like it's got to be because the tibial plateau's here. They're like, it's way down there. Yeah. So that's kind of where that one is on that one. Okay. Then we're going to do superior aspect. Okay. So right above the patella. Okay, all right, we've got that superior pole. If we just take our finger and just kind of drop it back here, we actually have what we call the trochlear groove, okay? And so it's just how the patella tracks in this. There's a groove right in between the lateral femoral condyle and the tibia. If you really dig, you can start to feel the edges of the condyle. Sometimes that hurts them because that quad tendon's right there, and that can cause some pain. So I just say, just be careful. Again, if you like to flex and extend, you can kind of feel where that groove is because you can kind of move that tendon, that quad tendon will kind of roll with it a little bit, and that patella will move a little bit on it. But that's where your trochlear groove is going to be just superior to your patella. Okay, so right in that area right there. Okay. Okay, and then again, patella. You fail if you get that one wrong. Okay, everybody get right now. You fail. Get that one wrong. Is that too direct? Is that what that is? Sorry on that one. Hope that's I can't do that one. All right, and that's it. All right. So everybody, grab yourself a partner. Let's go.